So today is day 3 post-op from a 2-level cervical disc replacement. I'm creating a little vlog so people can watch it and understand what they're in for. Oftentimes people are hesitant to do things they don't know what the future has for them, or if they're just reluctant because they don't know how to prepare for it. As I mentioned yesterday, I did not take any severe medication since the operation. On day 3, I did take some Tylenol last night. I was having a little bit difficulty with swallowing foods and water, and I figured rather than be dehydrated, I'd be better off doing that. I didn't need heavy enough medications like oxycodone, which was prescribed, or muscle relaxers. I just didn't feel that was necessary, so I went with the Tylenol. It definitely helped. I realized yesterday I was making an effort to swallow, realizing every time I needed to swallow that I was making a concentrated effort to. It still hurts a little bit to swallow, but it's not as bad. Last night I ate some salmon, which is a very soft fish. I would highly recommend that if you're looking for a soft food. It worked really well for me. I was fortunate enough to have someone prepare that for me. That was great. So today is day 3. I'm going to do some light cardio. We're just going to be walking on the treadmill for 30 minutes. You can do that on a treadmill or outside. I chose a treadmill because it is fairly cold outside, although I think tomorrow I'm going to go outside for the first time. I like the treadmill also because if I don't feel up to it, I won't be stuck in the middle of nowhere and have to get home either way. I could just shut it down. So this will be the first test. I do think cardio early on is really helpful. I could see how being sedentary can be a problem, especially after being sedated. You definitely have some lung capacity issues you have to worry about. So just walking and getting a brisk pace and getting your heart going could definitely help with that. We're avoiding running for the first couple weeks. If I remember the protocols correctly, we're just going to be doing some walking. I might play with the incline a little bit as well, just to get the heart rate up a little bit. Other than that, I'm going to be doing some scapular protraction, retraction, up and down, forward and back, basically. Just getting the muscles to activate a little bit. I am no longer wearing a collar. I don't feel it's necessary. So from my understanding, a collar is only used if absolutely necessary. I'm on day 3. I think by day 2, I felt that I really didn't need it. First day, because I was so groggy and not really in control of myself, I felt I should use it just for protection. I will say that laying back, if I miss the pillow with my head and it's too low and it extends my head, it can cause some discomfort. So I have to be very careful when I lay back to sleep. That happened last night. I basically grabbed my head and help it up because the pull over here is really uncomfortable from all the muscles that got moved around. For the surgery, I just don't feel like they're activating just well yet, but I'm not supposed to work on those just yet, so I'm going to sit tight with those. I'm going to do another vlog probably throughout the week to kind of keep track of things. I think the one thing that I learned so far is soft foods. Make sure you really prepare that ahead of time. I think I said this yesterday too, but just in case you didn't watch that one. The one thing I learned is salmon works really well. It's very soft. So by the end of the evening of day 2, I was able to eat that. And it was probably the first real meal I had other than hard-boiled eggs, just mashed up. So that was kind of enjoyable. I think I'll have a fairly similar meal, some sort of fish this evening as well. Other than that, we're going to do a little bit of exercise for about 30 to 40 minutes, 30 minutes on a treadmill, 10 minutes of scapular stuff, and then just rest for the day. I may walk again outside some point in the middle of the day. I'm supposed to be doing 30 minutes of cardio twice a day. I can't stress enough that cardio is absolutely important during the recovery process. Increases blood flow, increases healing. You also have some sedentary issues with cardiovascular during the process where you are unconscious. So for the surgery, so it's really good to get breathing heavy a little bit. The recovery rate also, I think, I feel will be much faster if your cardiovascular is on point. So if you are preparing for surgery, you probably would like to make sure you have some sort of cardiovascular capabilities prior to. And I know, hey, but I'm in pain, I can't move much. Walking is a great mode of cardiovascular. I don't feel like that is that hard on the neck if you do that. At the very least, maybe some inclines on a treadmill prior to getting surgery to help with the recovery rate and overall turnaround time. All right, so hopefully this will go well. I will report back tomorrow.